Somewhere along the road that Gavin was taking us, and I know there'll hopefully not be anyone in the room that remembers the 1930s, but I want to take you back to that time in the United Kingdom when we were faced as a society and communities with some of the most enormous social and welfare problems that any country, or most countries in Europe, were facing at that time. So we had severe poverty, people living in absolutely appalling housing conditions. We had diseases that were epidemic in the population. It's worth remembering, for example, that it was only in the 1960s that tuberculosis was finally tackled and eradicated in the city of Glasgow. That is in my living memory and in the living memory of people in this room. In the 1930s and into the 1940s, we searched for a solution, and that solution we decided would be for the state to stand up and meet the people's needs. Unfortunately, I think over the 50 years that then followed, that we've become complacent and that we have reached a default position where we expect the state to do everything. And in a sense, I think, I'm not an expert in this, but I think some of what's happening in A&E in England that you see reported on the news is because people turn up there because they expect the state to sort what might actually be quite a minor problem, rather than to take perhaps responsibility for themselves or for their families to help them take that responsibility. So in that process of the state taking that control and our expectations that the state will deliver, other forms of solutions to our problems as individuals and as communities have kind of been sidelined. And in that process of sidelining those alternative solutions, the third sector became that third sector, the afterthought. When I started the organisation that I head up, I called it Third Sector First Can't Do It Anymore because someone wanted to take us to court. But I was trying to make a subtle point that the third sector doesn't necessarily come third. It should be at the foremost in everybody's mind, and not in sort of third place to anyone. So, the way I see where we are today is almost where we were in the 1930s. We've got to look at these major problems, and Gavin's showing us the graph of doom, which is, I think, it's not up there at the moment, but that graph with things going that way and resources going that way. We have got a once-in-a-lifetime opportunity to design a new system. To design a new system that will be fit for purpose going on for decades to come. And we've got a real opportunity, and I want to pick up on what Gavin is saying here, to do that in a way that is community-led. So, where does the third sector actually come into this whole discussion? Look, I want to say a couple of things about where Gavin and Jeff have been taking the process so far. I've been kind of sitting on the sidelines, occasionally sniping, which I'm quite prepared to do from time to time. But I've watched them put together what I think makes a great deal of common sense. And I've watched them as they've committed to this idea of designing this service at community level. And I would hope that you all get that message that we are actually doing something in Dumfries and Galloway that's not about structures but about delivery. And I think they should be congratulated on that. The third sector so far has been sitting kind of on the sidelines to this discussion. And where we will finally come in, and where the proof of the pudding will be, is how the third sector is engaged at locality level. Now, I want to make some observations that are often difficult for me to make. In my job, my role is to advocate the role of the third sector. It's not to represent all the different third sector organisations that might be in this room, but to advocate that there is a role for the third sector in this particular instance in adult health and social care. But it's also at the same time to point out to third sector organisations that they need to be better at what they do. Look, there is an absolute sense. I can't give you evidence of this, but I kind of feel it and see it. That amongst health professionals and social work professionals, there is a discomfort with the idea that the third sector has a role to play as we go forward. There are professionals within health and social care who kind of think, well, look, these guys are amateurs. And they might not deliver the quality that we actually need. And what will happen if they don't do that when we're responsible for that quality? So, to say, part of my job is to say to third sector organisations, we have to recognise that there's a real fear out there, and we have to stand up and be better at how we deliver our services to people. So, where do I want to end on this? As we move forward, and Catherine sitting in the front here, I understand you're responsible for how we actually deliver some of these structures at locality level. I got that right, Jen? As we move forward, I'm going to be having conversations with Catherine here about how actually third sector organisations can influence the discussion at localities. Within localities is how we deliver services. How third sector organisations can provide additionality, not to do it instead of, but additionality to what the public sector is doing. And again, picking up on another point Gavin made, to do that and to do it in a way where the people doing that work are adequately rewarded. I've recently taken my organisation, it was easy for me to do because it only affected 2 permanent staff and 3 temporary staff. I've recently taken them through the living wage process. So that needs to be applied across the piece. We mustn't create a situation where we are delivering more and better health and social care but at the expense of people's income. That would be wrong. So we need to have those discussions, and we need to design our services together now. There's a word that floats about co-production. It's often used in the public sector, and you'll hear it in the third sector. I have to be honest, I haven't actually seen a lot of it going on. So the challenge for us when we get to this locality planning is actually to sit down as real partners and work out how we can deliver better services. How we can use third sector options to deliver the kinds of help that the case study you saw, the lady in that case study, might need. Now, we're already doing it, but we need to do more of it. I think at that point, it's a matter of questions for me. There's more questions in my head than there are answers, because I have been sitting on that sideline, Brian, not part of the discussion on the structures. I think what we'll tell is how we move forward and how we change culturally our attitudes to how we tackle this significant change in how we will deliver health and social care in our community.
Thank you.